If you're a healthcare professional and you are taking insurance, the patient is not the main focus. They're just not. They're not the ones paying the bill.
Yeah, no, it's true. And I actually had the pharmaceutical reps come in and actually ask for a printout of, their medications and what providers were actually filling it, so they could go and talk to the ones that are prescribing it, so they could go and talk to those providers that weren't, and incentivize them to prescribe those medications. So, what we see on the backside of pharmacy, the patients don't see it, even the providers don't see. So we are the ones with the experience. We have been watching. And I do mean it. Insurance companies are an overreaching arm of big pharma. They are just one with the other, birds of the same, it's exactly what it is. The insurance company is not there to, you pay me and I'll take care of you. They're taking your money and then they're controlling and dictating your care. I personally haven't had insurance for a long time. I just started to realize when I calculated, oh my gosh, I'm paying a lot of money for what? And then I started thinking too, I go for these well checks, right? Every so often that are covered for free. Everything's electronic. So it's all tracking. They're tracking every time I go and I said, you know what? I want to disappear from that. I don't want them following my medical history. I don't want them knowing what I'm doing and how I am. And the last time I went, which was so many years ago, they handed me a questionnaire, like, how do you feel today? Circle the smiley face on how you feel. It was so just detached from a connection to the provider. And the entire time I was at that appointment, her back was to me. Yeah. She wouldn't even look at me and engage. And I'm aware as someone, who has training and experience, I'm understanding my health. But what if someone has no idea? And then here this provider's not even focusing on the facial expressions and seeing how the patient looks. I just felt it was so impersonal. And I was like, that's it, I'm done. I said, I'm not doing this anymore. And I started to realize before everything kind of exploded that there was something going on. I call it God moments in just life and in my practice of pharmacy, where I was pointed to things that didn't really make sense. But 2020, the pieces came together and the picture was very clear what's going on, what the agenda is. Through my research, and they say going down those rabbit holes, you do learn some things that wake you up and say, I can't participate in this. You feel it in your gut. It's true. There's something off. And we have to start paying attention to that again. I feel we've become so dependent on someone in a white coat or someone who has authority telling us what we should think, feel, and how to act. And instead, we're not listening to our God-given rights over ourselves. And he's gifted us with intuition and wisdom and guidance. And we've lost that. We've lost that along the way.
Yeah, well, let's talk about that. Let's talk about, our goal of our podcast is to educate and empower individuals to take charge of their own health. Yep. And I think sometimes how we define health now is really silly. Some people think that in order to be healthy, if you're over 60 years old, you have to be on a statin. Seriously, right? And I just think that's obviously ridiculous. I would never recommend a statin. So what is real health? Jen, tell us what real health is. That's what we're discussing today. Tell us what you think real health is. What does that mean?
Well, it's coming back to, like I said, knowing your own body, not running to a pharmaceutical as first-line therapy. The root cause, what's the root cause? Why are we experiencing whatever it is we're experiencing? What's going on? I believe there's also food allergies. I think we should get back to understanding what is good for our body and what's not good for our body. Diet and nutrition is important. Connected to God, however that is for anyone. Like, is it being out in nature? Is it going to church on Sunday mornings? What is that connection for you that gives you purpose and fulfillment? And when you have that connection, you do live better and you are healthier. I think lifestyle modifications, being active. And active doesn't mean you have to run a marathon. It just means movement. Movement, just movement in general, whatever you can tolerate. And you don't have to start, thinking, oh my gosh, I haven't done this in years. Start small, work your way up to whatever you can tolerate, whatever you feel. And pay attention, start paying attention to your body again and realizing that, pharmaceuticals are not the answer. And it's odd coming from pharmacists to say that, but it's not the answer. It's the last line. It's when all else fails, you should try it. And regards to your statins, no one should be taking a statin. I mean, those things are just toxic. It's so bad. What they're doing to us and how they're manipulating data and, the testing, the levels, like, oh, your cholesterol's high. And they're just manipulating the numbers to scare people into thinking they're going to have health problems, changing their diets, putting them on these medications that are actually making them worse and not actually giving them the quality of life that we're told we're going to give them through these medications.